Hello all, welcome back to my channel. So today I'm discussing the topic of snoring or mouth breathing in children. So why this topic is important is because many of us are not aware the implications this has on a child's scholastic performance, day-to-day activities, and also his or her behavior. So sleep is a very important body function, essential body function, and a good sleep is critical for a normal daytime function. Before we go into the further details like how this disease affects a child and all, first we should have a rough idea about sleep cycle. Sleep cycle is divided into NREM and REM sleep. NREM has different phases and then there is REM phase. So total duration is 90 minutes. So during the REM sleep, what happens is, it's a physiological mechanism that the muscles of our body are relaxed in general. This is to prevent enactment of dreams and to prevent bodily movements during sleep. So what happens to the airway muscles? The muscles in the airway, they are not attached to bones which can keep them taut even when there is no muscle tone. So once the muscle tone is gone, these muscles are lax. When the person is in the REM phase of sleep, these muscles are lax. And super added to that, if there is any obstruction in the airway, mild obstruction due to any cause, that causes snoring, mouth breathing, and difficulty in breathing at night during sleep. So who are those kids who are at risk for the snoring, mouth breathing and obstructed sleep? Those with adenoid tonsillar hypertrophy are the ones who form the largest group. But that doesn't mean that all the kids who have adenoid and tonsillar hypertrophy have this snoring, mouth breathing and obstructed sleep. And the other kids who are at risk to develop this are those who are obese. This is due to excess accumulation of fat around the muscles, and those who have deformed jaw, face and neck. So why are we concerned about sleep per se? Because during sleep there happens consolidation of memory and formation of neural pathways, which is critical for a complete neural development in a child. So the peak of this adenoid and tonsillar tissue hypertrophy is around 3 to 6 years of age, and this is the peak age of neural development. So if a child has this obstructed sleep during this age, it can affect the child's cognitive abilities. So what are the symptoms and features we should look out for in our kids? During daytime, the child will be irritable. Behavior will be, the child will be hyperactive, impulsive. The child will be violent towards other kids. From school, you can get complaints that the child keeps hitting other kids. And the child will not be able to concentrate for longer duration. And there will be memory deficit, poor understanding, poor learning. During night time, there will be, as we already mentioned, mouth breathing, snoring. The child will not be maintaining just one position in sleep. The child will be restless throughout the night. And the child will be having different positions of the neck and head to relieve the obstruction. And also there will be excess sweating. And girls, there can be a nocturnal enuresis, that is bedwetting. It can also be seen in boys, but it's more common in girls. And one thing to note is, a parent may not always know that the child has this obstructed sleep issue, because all these features happen late at night during the deep phase of sleep. So during that time, parents are also in their own respective REM phase of sleep. So there's less chance that the parent might notice these things in a kid. And during daytime, if the child is having these features, so one should look out for this and get the child examined by an ENT surgeon, and also get a sleep study done, because that's a standard investigation. Then coming to management, I'll be just briefly mentioning about the management. I'm not going into detail about the surgery, its complications or anything. If there is only adenoid hypertrophy, it responds to nasal steroids, nasal spray, when given for 40 days to 6 weeks. And if it is refractory to treatment, then you can go ahead with surgery, adenoid and tonsillar, because it relieves the airway obstruction and gives a good night's sleep. There is another modality of treatment, CPAP. For adults, this is the first line treatment, and for kids, it is reserved for those who are treatment failures, those who are obese, and those who are failed, those who don't have benefit from surgery or from this medical treatment. So, at least 3 hours of CPAP machine usage at night is proven to have significant effect in the child's scholastic performance and behavior. So I hope I have given you some idea about this significance of mouth breathing and why it should not be overlooked in a kid. And on top of the snoring and it causing other neurological issues, there can be changes on the face also. There will be pinched up nose, the tooth will be protruding, and all those things. So I request all the parents not to take this snoring, mouth breathing lightly, and to get your child examined by ENT surgeon if the child presents with daytime irritation and memory deficits and poor attention. So with this I conclude my today's video. Please like and subscribe and let me know if there is any doubt in the comment section, and you can also suggest if there is any topic which you need some clarification on. Thank you.